Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And today's topic, engrossing death. Exactly. Death. And I make a joke out of it to start with because I think that's how a lot of people deal with death as a topic. But I imagine as a healthcare provider, you've got to...
I see a lot of it. I came in last week and you said, how you doing? And I said, I have a lot of death around me.
Yeah.
And it was just a period of time where a lot of patients died and some got, probably terminal diagnoses. Mm-hmm. And it's, as a provider, my first practice, there was more of that. We lost about 3 patients a week, and they were all young men with HIV disease. And it's less so now because mostly I'm taking care of healthier people. But it's still like wearing a shadow over you. It's just, it kind of presses down on your soul.
How do healthcare providers deal with that?
The problem is they don't. So healthcare providers are super good at compartmentalizing.
Right, you'd have to be, I imagine.
You kind of have to be. Mm-hmm. So, and it's, you can click into that clinical part of you and just put blinders on.
Right.
But you pay a price for that. So it's really hard to maintain the balance and still be a human being. It is frowned upon to cry or express an emotional reaction to somebody's death. Mm-hmm. And especially other providers, probably because it's a little scary for them, they really keep you at arm's length. They don't want to hear about it.
Frowned upon in what sort of context? I mean, I imagine you don't want to do that in front of patients.
It's not professional to have feelings about patients.
Right. What if you're 2 doctors outside of the
Unless you're
workplace?
mad at them and you want to vent.
Okay.
Which I think is unfair. But anyway.
Wow. So in any setting, you just, as a doctor with other doctors, you don't show your emotions? You're not supposed to?
No.
Yeah.
You're really not supposed to. Although I sometimes they break through, and I witnessed, for example, somebody dying in the ER at Mad River Hospital, and the physician that was taking care of him locked eyes, and there was a silent plea for help, but I couldn't. There was nothing I could do to help him. So it's really hard. And we have complicated feelings about it. Mm-hmm. Like, did we do enough? Mm-hmm. Did we make mistakes?
Because it's not just something you witness in a lot of instances. You're involved in the process.
You're involved in the process, and then you're also kind of critiqued afterwards. Did you do everything you could? Was it a timely diagnosis? What did you miss? What did you miss? What did you miss? Yeah. And that kind of stuff keeps you up at 2 a.m. It's awful.
Bet.
And we feel helpless and guilty and like we failed. A death is like a failure.
Wow.
So, and it comes from not really being taught how to deal with death when you're in school. I don't know how they teach physicians, but 40 years ago at the PA school I went to, we didn't really talk about it. And the first death of a patient I saw were 2 actually young people. The first 2 deaths was in the ER, and one was a child whose mother accidentally backed over him with the SUV, and then one was a teenager who was riding out with her friends, and she was in the front seat of the car with her feet up on the dashboard, and neither survived. But they were full codes, and everything about it was terrible. Everything, the physicians trying really hard to be on point, the other physicians trying to teach us from this moment, even though we're just students and traumatized.
Wow.
And then the child, the mother running up and down the hallways and wailing, and nobody supporting her. It was too involved with her child for a kid to be, or like a nurse to step forward and help. And I don't think at the time there were chaplains.
Wow.
And I was shocked by that. And usually as a medical student or PA student, you have somewhat of a freedom to go hold hands and be the compassionate human that nobody else has time to be. But I was just so blown away. I didn't know how to do that at that point. It was awful. So there's also no real place that you can go to get help after somebody dies. And I was a part of this researching this. I read an article in the British Journal of Medicine that encouraged people. And I thought, well, this is going to be a really juicy research article with lots of numbers and stuff. And it's basically, look, you guys, if you need help, you should get it. And you shouldn't be ashamed to ask for it. And I thought, well, duh.
That's how basic the information had to be.
Yeah, that's
to
about
be
what we get.
Wow, what a blind spot. What an interesting blind spot to have.
Yeah, it was a recent article, too.
Huh.
And then everything is so abrupt, usually, even if somebody is not necessarily dying from trauma, even if they're on hospice at home and it's suspected death. You know, one day you are gung-ho involved in the process, and then the next day you aren't. And that's when I came in and I mentioned that I had an elder patient die at home recently, and nobody told me. She was under hospice care, so the first thing that happens there is their medical director takes over providing care.
Okay.
And then you're just out of the loop.
You're just not part of it anymore.
You're just done.
Wow.
But this is somebody I'd seen for like 4 years, and
Right.
I had a nice relationship with her, and you know, she had dementia, and what she was telling me about her world, I was willing to patiently listen to, and it was awkward. I felt like I should have been told by somebody,
Right.
and everybody probably assumed that the nurses from hospice told me.
Would you, if there were assumptions that you had been notified, but do you feel, I guess not what sort of pressure do you feel I guess I'm trying to figure out what I'm trying to ask here. Do you feel feeling bad about this woman's death at all?
I feel like the care she got from our clinic was really good. I will say I felt like my care was as good as can happen in Del Norte. And I think the hospice people probably took care of her. Her family took excellent care of her. It's just, you know, you're so involved in this, and this is what keeps you up at 2:00 in the morning, and this is what you think about the first time when you sign on in your computer in the morning, like, what's going on with her? What can I do? How can we make her more comfortable in whatever direction she's moving today? And then it's just gone. And that was a problem in the AIDS epidemic early on in the Castro, is it's people, caretakers usually, what we should be calling husbands. But lovers and partners in groups around people were just doing everything as frantically as they could do. And then all of a sudden it was gone.
Do you think it's I haven't read further into your notes than where we are, but do you think that experience that you had formatively at the beginning of your career in the Castro in the 80s and early 90s, does that change your perception of not death itself, but of the attitude or that kind of blank space in your profession when it comes to dealing with death? I mean, was that
totally. Yeah. There are a lot of doctors, I mentioned this to you, a lot of doctors, when they know somebody's dying at home, they'll light candles, and they'll have special, not really religious, but special thoughts sending out to the patient. And we are still involved even when we're not medically. And I kind of felt we did that in the Castro, but we lost about 3 people a week on average that we were intensely involved with, and that were part of the community of the physicians I was working with. And I would say I felt, you know, I'm not a metaphysical person, I'm a scientist, but I still feel that energy around me sometimes. Now, I can't identify it as an individual, but it's like a thank you.
Oh, yeah.
Yeah, I'm telling ghost stories at the end of this.
Okay,
I'll tell you some more.
Yeah.
But as a result, primary care providers tend to disappear. And some, I think, don't know what to do. Now, I've had more experience with dying patients. Maybe I shouldn't say that.
Right.
But early on in my career, when I was working at urgent care, we had a man come in, and I think he was down to maybe about the last 6 to 8 weeks of his life. And he was trying to get an appointment with his primary care physician at a local community clinic,
Oh, no.
not UHS. And he couldn't get an appointment. So he came in to see me at acute care, and he wanted me to call her and tell her that he was in need, that she had always taken care of him, that he wanted to see her once more before he died, that he wanted her to know that she was, that he was there and, going through this process.
Wow.
And I called over and they blocked me. I didn't work there at the time. And then,
They blocked you. What's that mean?
well, the receptionist didn't let me
Gotcha.
speak to the physician, and I was using backdoor numbers, right? Because I had all the extension numbers. That was back when people that answered the phone. And then I wrote a letter. I was so frustrated. I wrote a letter to the head of the organization, and I said, "This shouldn't be. There's no reason for this." And I got a scathing letter back from the medical director, not attacking me personally, but not addressing the problem.
Uh-huh.
And he died without seeing his primary.
Wow.
The only way I can understand that is that she just wasn't ready. The physician wasn't ready to face his death for some reason, and so she just kind of faded out.
Wow.
It was horrible. It was awful. And I think that happens a lot.
Was there any sort of liability concern with that scenario?
Not that I could see,
Wow,
but
that's
I
just
didn't have
so-
access to medical records or anything.
That's so dark. That's so sad.
I think doctors, doctors are wonky people anyway, and they don't really know how to talk to people, a lot of them. And a lot of them go into surgery because they don't have to talk to people. And that's part of the reason nobody ever answers the phone or returns their messages is they just don't, you get your shot in the exam room and then that's kind of done.
This next section you have here, it's an interesting sort of take on it for me.
Right,
because
it's
we're
a
talking,
pivot. And I
It is a
pivoted
pivot.
into my clinical self.
Right,
Yes.
exactly.
So as part of compartmentalizing, what actions should patients take if they have a catastrophic diagnosis? So if death is on the table, I guess, if you're talking about it, I think the patient should bring up their conversation to their provider. I think the provider should bring it up, but that oftentimes doesn't happen. So that as patients, don't feel like you need to hold back and trying to get your provider's attention on this. Don't make it a doorknob phenomenon.
But the guy you just talked about was trying to do something similar to that, right? And couldn't get through.
Right. I think
Wow.
that was for a reason.
Yeah, man.
So, but you could ambush a provider. I'm just here for my hypertension. Anyway, so I think most people should talk about what they're hoping, their death process will be like. And I think most people want to be free from pain and fear. I think that's kind of baseline. And I think a provider can hear that, document that in the chart, and then kind of as the person's going through their process can advocate for them. And then get some understanding about how that's possible. There's different forms, and I'm going to reference them in a minute. But how do you document so that your voice has meaning after you can't speak?
Wow, okay.
Okay. And then talk about cultural expectations. So my time at UHS has told me that nobody necessarily does their process the same.
Right.
That what's important to somebody might just be not on the radar to somebody else. So make sure that if there's a cultural expectation that's also talked about. I think oftentimes patients want reassurance they're not going to be in pain, and that's like the biggest burden.
Right.
So that process, that document, is called an advance directive.
Okay. Okay.
And UHS has a really great booklet that has questions that the average person might not have thought about unless they somehow have been through this process with a close loved one. But this booklet also has continuums, which are super helpful. Like if you say, I don't want to feel any pain at all, or, I can go with a little bit of pain if my consciousness level is being, and maybe I want to have time to say goodbye and I still have to use words and things like that. I like that about it. It has the sliding scale, so you can give whoever is in charge of following this document your really refined view of what it is you want.
Are there any can you Google templates for advanced directives? Is there a
Probably, but some of them are. UHS is spiritual. It is medical, and it is God, how to explain it? It's just the cultural vibe,
right?
is, of course, there, but it also talks about things like autopsies. Nobody wants to think about
Yeah, probably that's not
having an
anything.
autopsy on themselves, or what does it really mean to donate your organs? Okay, so the way they do safety standards in cars is they have collision dummies, but they also use cadavers.
Do they really? I didn't
Yeah,
know that.
they put them through a horrific crash, and then that's not what I'm thinking of when I'm talking about donating my organs.
It's pretty badass.
Or having, hardballs lobbed out your eyes to see what kind of force it takes for
Right.
an orbit to burst, et cetera,
God.
et cetera.
Wow, okay.
Yeah, I see your face there. You're looking a little. But, I'm thinking, I'm going to give my kidneys so two people
We're
can
save you
live.
all these, I'm
and,
gonna pay it forward.
all that kind.
We're gonna
So-
see how to make you go squish.
Yeah, make some decisions about if you're like, I don't care what they do with my body. Okay, then there you go. And then, so I actually, if you're not a patient at UHS and you want to see this document, they're very community oriented.
Really?
So I don't think anybody would mind. You probably won't get the actual booklet because those have long been given out, but they have copies of it.
Okay.
The other thing is you should think about what burial options are important to you. Like for my parents, when my mom passed, she was all about cremation, but I want to be composted,
Oh wow.
and I've envisioned my body being taken up to the composting facility, which happens to be in Washington. And I right now, I don't think my kids know that.
Oh no. Okay.
Or they would think about that. So I'd probably be headed for the ovens, whatever the cheapest thing is. But I don't want to do that. I've already paid for composting. So,
Have you? You've set it up?
yeah,
Oh wow, that's really cool.
yeah.
So what do they do? I'm just curious. What's the
They
end
put
result?
you in like a pod, very kind of creepy, and you have to be dressed in like organic
Organic
garments
fibers and
and
stuff.
stuff
Yeah,
like
yeah.
that because, well, at the end point is that your soil, right, and they return you to a wild space. So imagine that if you have like an artificial knee or something, they'll have to
Right.
sift through. But they put you on cedar chips and they put hay around you and they, like braid your hair and put flowers and, cover your torso with flowers. And then I imagine you have, you can't really have trinkets that are non-biodegradable. Those will be sifted out later. I imagine, like, for example, I would probably take a couple of my pet's ashes and stuff like that. And then you just lie there and it takes about 4 to 6 weeks. They put special enzymatic kind of sprinkles over you so you break down faster. It's not like lye or anything, or
Right.
lime, but it's more like probiotics for dying. Yeah. And,
That's really interesting.
Yeah, and then they sift through and they break up the bones after all the flesh is gone. It's a pretty quick process, 4 to 6 weeks.
Wow.
And then they take things out like your artificial hip or whatever. In my case, probably my lenses.
Oh, okay. Yeah, right.
Because I have special lenses in my eyes. So anyway, that is not a topic that my kids are ready to discuss with me. So I'm going to put it in the document.
Have you tried to talk to him about this?
Oh, yeah.
Oh, wow. They're not
Even the
having it?
medical one is like, what are you
Oh, my
talking about?
God.
So
It's going to be a big shock.
I know. So there's also a document toward the end of life which is called a POLST in our acronym language. So POLST, which stands for Physician Orders for Life-Sustaining Treatment.
Okay.
And this is stuff like CPR and how aggressive you want the medical community to be if really there's very little hope. You know, there's the ER nurses who have really grim senses of humor have what they call slow code. That's where it's like a code in slow motion. And the codes I've seen, by the way, don't last very long. They probably last less than 5 minutes.
Right.
And it's not like, live, damn it. It's like, well, we've done everything.
Yeah.
It's all over. But when my mother was dying and I mentioned I had to go down to the Bay Area to attend to some of her business. The physician that I was telling that, the first thing he said, it's not like, oh, I'm sorry, you know, does she have very long? Like, how can I support you? It's like, does she have a pulse?
Oh, my God, really? Wow,
Yeah, because he's an ER doc.
We want to know what to do, what he has to do then.
Right.
So how much of a thing is it where you actually have to say the time when somebody dies? Is that a real, because it's a part of every death in TV.
Oh, you mean like in Grey's Anatomy, time of death? Yeah, because they're being recorded.
So somebody has to say that.
That's
right?
like at the end of a record.
Okay.
Yeah.
Okay.
So yeah, it's like, and they're yelling things out that are, I think sometimes they're probably actually recorded
Wow.
on some kind of, I don't know, audio device. And sometimes there's a nurse sitting in the corner writing times and procedures down.
So that is a thing. Okay.
Yeah, it is
cool.
a thing. Time of death, time of birth, and time of death. Those are well documented for us. So when you want to let your family know what you want, do it in writing. And it's really nice to have a single family member who is the designated voice for the family, and that everybody's agreed beforehand that they're not going to muddy the waters when this voice speaks.
Is there a name for that, like privilege, like power of attorney?
Sometimes it's durable power of attorney for health. So like when my mom was septic, and she ended up in the ER, and I talked to the ER doctor. At that time, she didn't have a pulse. That was kind of in process. And he asked me straightforward, do you want us to code her? And I had to say no.
Wow, okay.
And my sister was on the other line, and she supported me through that. But, you know, it has to come out of somebody's mouth.
Right.
And, you know, when people are coded, the codes I've seen at Sutter Coast, like a long time ago, actually, you know, people are flying in and out of the doorway, so the door is open. And Sutter Coast usually has all the rooms filled. It's kind of like an amphitheater. It's better than watching TV if you're bored waiting for the doctor to come evaluate your stub toe. And people come out into the hallways, and the nurses don't always have time to shoo them back, although they really try. And there's like things being yelled, and a person is being like perhaps catheterized with a urinary catheter, or if they're doing CPR on somebody, that means that their clothing is stripped off of them. It's just cut off of them. There is no dignity in it, and it's not necessarily private. And even though it doesn't last very long, it's weirdly like watching TV.
Wow,
you know?
Interesting.
And I don't think that, you know, it's really distressing to me to see patients come out in the hallway and stare at somebody in that condition.
Right.
Yeah. So if you're in the ER when it happens, knock it off.
Have some, you know, little class.
So now I'm ready to talk about ghost stories.
Okay.
Do we have a couple minutes?
We have, let me give you an exact, we're just about 5 minutes.
Okay. Well, I don't really understand if ghosts exist. And I haven't put a lot of time into it, but weird things have happened to me in the context of medicine. And the first one I've already talked about publicly is when when I was working in the Castro, we of course had the high death rate. I had to fly back to North Carolina to take my final PA exam to be credentialed, and some random woman in the airport came up to me and said, "You have dead people hanging all over you," and she kind of like patted me down like I had dandruff or dog hair on me or something, and that satisfied her. And I felt a little lighter after that. I don't know what that was about.
Wow.
But I do have the sense that people are around after, and I have no spiritual connotations of that. But it's actually, if I know them, it's kind of pleasant.
Right. Sure.
And if I don't know them, it's a little creepier.
Okay.
So
You're able with that feeling to discern
yeah.
familiarity with
Yeah. I have a sense of personhood of who it might be.
Wow.
And I don't know. It's like if you hear like one of your pets from the other room, it's the sound you recognize well, and it's, there's peace in the kingdom.
Wow.
There's a feeling of that. I was present when my grandma rang a doorbell. Because that was her code that she made. And so it was after her funeral, and all the family got together, and we were sitting around kind of debriefing, and all of a sudden the doorbell started ringing.
Wow.
So I don't know what that is. My mom also said she would ring my doorbell. I didn't tell her I didn't have a doorbell, but I did get a doorbell ring. And
Really?
I don't know how that's possible.
How do you mean? What do you mean? You didn't have a doorbell, but
I
you
don't
had
have a working doorbell, but a doorbell rang.
Wow.
So I don't know
Wow.
what that means, though.
Yeah.
So when there's a lot of supposedly spiritual energy associated with things like hospitals, and there's a lot at the original Open Door on 10th Street, actually next door to the original Open Door. The original Open Door is Tin Can Mailman on 10th, but the second Open Door, they moved in after they left that building into a mortuary.
Oh, wow.
And so they redid it, and it's not only the mortuary building, but it's the house where the mortician lived. So it's kind of old buildings. And there are people who work there whose parents, and friends were embalmed and laid out there.
Oh my God.
And so oftentimes when I was working there, kind of like in the late, just before Y2K, I'd be there at 9:30 or 10 o'clock at night doing charting, and somebody would come by and stroke my hair.
Wow.
And then I would call my husband and say, if I'm not home in 10 minutes, you send the police over.
Oh.
It was like completely unnerving.
So you're just sitting there and you just feel somebody walk by
Stroking
and
my hair, kind of like it's time to go home now. And I was the only one in the two buildings.
Oh my God.
It's a creepy building to begin with, but I don't know what the heck that was about. So those are my ghost stories.
Wow.
That I feel like are the most meaningful. I do have the sense in hospitals that there's a vibe. I don't know what that means. I don't pay attention to it. I'm not making too much of a big deal about it, but it's like a hum in the background.
Wow.
Yeah.
So you pointed out this, like, as far as like the care of healthcare workers, healthcare folks, there's this kind of gaping hole, it seems, in counseling, in any sort of supportive infrastructure that would help you guys deal with death. What would you like to see change about that?
I'd like to see a collegial effort, maybe a part of like staff meetings or something where people can say, had this really tough patient, or in the ER, because babies die. That's the worst thing to see in the ER.
God,
I lost a baby. And in that we all kind of acknowledge that was hard. And somebody says you did everything you could. And, your care was great. You don't even have to be great. It's just not horrible, because we really shred ourselves when things happen. We really do.
Thank you for this. This was wildly interesting. I had no idea this was even a topic. So, but thank you. Thanks for sharing. Wow. We'll see you next time for the next Health Matters.
Okay.